Today, we're talking about something that so many people with multiple sclerosis deal with, but it often stays in the dark, literally. We're talking about sleep. We're going to get into why a good night's rest can feel so out of reach and unpack that really tough relationship between MS and just feeling tired all the time. This quote from Bridget, a military vet with MS, just hits the nail on the head. It's a double whammy. This isn't just about being sleepy. It's about having the deep, draining fatigue of MS and then piling the fatigue from not sleeping right on top of it. It's a whole other level of exhaustion.
So here's our game plan. First, we'll really dig into that double whammy. Then, we'll look at how doctors figure out what's actually messing with your sleep. After that, we'll get into some powerful solutions that go beyond just taking a pill. And finally, we'll talk about how you can start to find your own path to getting some real rest. Okay, let's start with that double whammy. Now, if you have MS, you know fatigue is one of the most common and, frankly, draining symptoms. But when you add sleep deprivation to the mix, the problem doesn't just add up, it really multiplies. And just look at these numbers. This is not some rare issue. According to MS specialist Shirley, somewhere between 30 and 60% of people with MS also have a sleep disorder. That's huge. It really shows you just how connected these two things are. So why is sleep so hard to come by? Well, a lot of the time, the MS symptoms themselves are the culprit. You've got things like chronic pain or that awful pins and needles feeling, or muscle stiffness that just makes it impossible to get comfortable. And that's not even counting having to get up for the bathroom all the time, or legs that just won't stay still. A peaceful night can start to feel like a fantasy. And let's bring it back to Bridget. Here's someone living a full, busy life. She's a parent, a union organizer, and she was surviving on just 4 to 5 hours of sleep. For her, it was the endless tossing and turning and the numbness in her limbs that kept her up. That's the double whammy in real life, affecting everything she does.
And that leads to a really crucial point. You can't fix a problem until you know exactly what the problem is. It all starts with identifying the specific things that are wrecking your sleep night after night.
One of the big ones is something called obstructive sleep apnea, or OSA. Dr. Boster has a great way of explaining it. Basically, when you fall asleep, the muscles in your throat relax. But for people with OSA, they relax so much that they literally block your airway. That snoring you hear? That's your body fighting to breathe. And every time it happens, it yanks you out of that deep, restorative sleep you desperately need. So how can you tell the difference? Here's a really simple but powerful question to ask yourself. How do you feel when you first wake up? With typical MS fatigue, a lot of people say they wake up with the most energy they'll have all day. But if it might be sleep apnea, you wake up already feeling wiped out, maybe even with a headache, because you never really got good sleep. Okay, another major sleep wrecker is restless leg syndrome. And we're not just talking about fidgeting. RLS is this overwhelming need to move your legs. And the worst part? It usually kicks in right when you're trying to relax and go to bed, making it incredibly frustrating to even get to sleep in the first place. Now, to really get to the bottom of it, doctors will often suggest a sleep study. And I know, that can sound intimidating, but all they're really doing is gathering clues. They're looking at your brainwaves to see when you're in deep sleep or light sleep, checking your eye movements for REM sleep, and monitoring your breathing and body movements to catch anything disruptive, like those little pauses in breathing from apnea. And for Bridget, that study was a game changer. It showed she didn't have sleep apnea, but, and this is key, it revealed her sleep was super fragmented. She was waking up all the time without even realizing it. Her sleep efficiency was low, meaning she was spending a lot of time in bed, but not much of it was actual quality sleep. That specific diagnosis pointed them toward the right solutions. So, once you have that diagnosis, what are the solutions? This is the exciting part. So many of the best strategies aren't about pills. They're about behavioral changes and habits that you can control, which is exactly what Bridget was hoping for. One of the most effective tools comes from cognitive behavioral therapy, or CBT. The whole idea is to retrain your brain so that it connects your bed with sleep and nothing else, especially not frustration. The rule is simple, even if it sounds a little weird. If you're still awake after 15 or 20 minutes, you get up, go to another room, do something totally boring, like read the dictionary, not your phone, and only go back to bed when you actually feel sleepy again. You're breaking that frustrating cycle. And then you have the basics of good sleep hygiene. These are simple habits, but they make a huge difference. Things like going to bed and waking up at the same time every day, even on weekends, keeping your room cool, dark, and quiet, and this one is huge. No screens for at least an hour before bed. That blue light from your phone or TV is telling your brain it's daytime and it needs to be awake. Now, what about medications? Things like Z drugs, common sleeping pills. They can play a role. They can give you some short-term help, maybe to break a really bad cycle of insomnia. But the goal is always to use them together with these other behavioral therapies. They're not a long-term fix, mostly because they can leave you feeling groggy the next morning, which just feeds right back into that awful double whammy. So you see how it all comes together. You get a diagnosis, you get a toolbox full of strategies, and it all leads to finding your own unique path to rest. Because this isn't a one-size-fits-all thing. It's about finding what works for you and taking that first step to a better quality of life. And if you take away just one thing today, please let it be this advice from Shirley. Talk to your doctor. Seriously, let them know what's going on. Don't just assume it's normal MS fatigue. That conversation is absolutely the most important first step you can take. And that's exactly where Bridget is now. Her journey isn't over. As she says, she's still working to find that balance. But her story is so powerful because it shows that you can make progress. It's all about finding that harmony between your days and your nights so you have the energy to do the things you want to do. And that's really the bottom line here. There is absolutely every reason to be hopeful. We know so much more about this now. There are more options, more research. Finding restful sleep, even with MS, is more possible today than it has ever been. So, we'll leave you with this to think about. Maybe it's making that doctor's appointment. Maybe it's just committing to turning off your phone an hour earlier tonight. What is one small step you can take, starting today, to begin finding your balance? Thanks so much for joining us.